Let's look at vagus nerve stimulation now. Surgical stimulation is an option where a lead is wrapped around the vagus nerve and is stimulated by an implanted device in the chest. It sounds easy. That's a nice little picture there. But it is surgery, and it leads to some potential problems. For example, wires can break internally, causing a mess. It's difficult to remove this and results in rather dramatic scarring. So not a lot of people are lining up for this procedure. So a few other groups began to develop some non-surgical options. People began to investigate ways to stimulate the vagus nerve through the ear, for example. This can be helpful for some forms of epilepsy, but remember, the vagus nerve is very long and prone to injury any place along the way. It travels from your brain, then past your ear, down your neck, into your chest and abdomen, a very long route with many opportunities for injury. Let's take another look. Your vagus nerve is actually two nerves, right? One going down the right side of your neck and one going down the left side. It goes down your neck and then it branches to the heart, at least the right vagus nerve does, the stomach, liver, gallbladder, pancreas, and intestines. Now imagine if it was damaged for any reason in here. Gastric surgery, abdominal surgery, heart ablation, gallbladder surgery, you get the idea. It's a long nerve and could be damaged most any place, right? Now, if you put a stimulator in your ear, can you see how if your nerve was damaged any place below that ear, let's say it was compressed at your neck, what good would stimulation be, I ask you? If you stimulate the vagus nerve from your ear, the nerve cannot be damaged any place below that level if you want it to work. Do you get what I'm saying? Another interesting fact, if you understand that you have two vagus nerves, right? One on the right side and one on the left side of your neck. If you have tachycardia and hope to slow down your heart, you are out of luck with the vagus nerve stimulators. The reason is that almost always it's the right vagus nerve that connects to the heart. This is why in vagus nerve surgery, they always stimulate the left vagus nerve. If they try to do it on the right, the patient is at risk for heart block. So using a vagus nerve stimulator will not directly affect the heart. Again, stay in the science. And you can avoid some of the crazier things I've seen out there to try to sell you something to stimulate your vagus nerve. Remember, it's not all about the vagus nerve anyway. It's a neurotransmitter problem causing the vagus nerve problem. And this neurotransmitter problem is affecting much more than your vagus nerve. So let's review. What are the limitations of vagus nerve stimulators in our patient population? They don't help with genetic disorders of acetylcholine production. They don't cover you for deficiencies that could limit the release of acetylcholine. They don't help preserve whatever acetylcholine is released by blocking acetylcholinesterase. They won't work if the preganglionic vagus nerve is damaged for any reason. The vagus nerve, after all, is the longest cranial nerve in the body and very prone to injury for that reason. Compression by vessels, bones, ligaments, bone spurs, calcium deposition, stretch injuries such as whiplash, damage by radiation or heart ablation, abdominal surgery, accidental trauma. So many options for damage here. Vagus nerve stimulators cannot help slow the heart because the right vagus nerve connects to the heart, but can't be used with stimulators because of the risk of heart block. Vagus nerve stimulators do nothing to boost acetylcholine production for the brain or lacrimal gland. Vagus nerve stimulation cannot do what Parasym Plus can do.